Welcome to the Real Integrative Medicine podcast. I'm Dr. Jordan Robertson, and I'm here to bring you the tools, insights, and strategies to take your health to the next level while using evidence-based integrative medicine. What's real? This is what we want to explore together. Research is ever-changing and not easy to interpret. We're bringing you the best that integrative medicine has to offer while sticking to the facts. Our mission is to elevate the practice of integrative medicine for clinicians and patients alike. Preventative solutions, nutrition, exercise, and sometimes supplements have a seat at the table in medicine, but only if we uncover real science-backed solutions. It's time to uncover what works and challenge what doesn't. Let's unlock your full health potential with an integrated approach. Ready to learn what's real? Let's dive in. Have you met anyone in the last year who isn't tired? We're going to talk about taking radical responsibility for your fatigue today. And this topic I think is really important because fatigue is a symptom that probably exists as a potential symptom for every single medical condition. And sometimes we talk about it as if the fatigue itself is going to help us diagnose you, right? So, you have fatigue, you must have adrenal problems. You have fatigue, you must have a thyroid problem. Fatigue is honestly the tip of the iceberg in terms of understanding what's going on with your health. And if you have fatigue, and this is why we're going to use this term radical responsibility, is that seeking the cause and then pursuing a solution requires so much of you. It requires so much of you that you have to decide, like in this moment, that you are no longer going to tolerate being fatigued. And if this is a goal for you to not be fatigued, you have to do stuff, unfortunately. And I'm not putting blame on you. So big distinction here. There's no blame on you that you are tired, right? There's no blame on you that you have the medical that you have that has made you tired. But it is your responsibility, very different. It is your responsibility to take control of your fatigue, regardless of the cause. Even if the cause, happened to you and it's something that you could not have avoided, you have to take radical responsibility for undoing it and getting to the bottom of it. So that's what we're going to talk about today, is that radical responsibility piece. Because one thing I will say about, my experience in working in practice, it always makes me think of that like Meatloaf, I will do anything for love, but I won't do that. Sorry, just taking a sip of my coffee. I will do anything for love, but I won't do that. For many patients, they have some kind of limit in their mind for what they will or will not do in order to pursue betterness. So you've drawn some kind of like arbitrary line in the sand and have decided like beyond some point, you are no longer interested or willing to pursue improvement. And often it looks like giving up something that you really care about, like alcohol. Or it involves addressing a particular habit that you are still deriving some kind of like secondary benefit from. Like you stay up late so that you look good at work and you're not willing to let that go. And so now you've drawn a line in the sand for your level of improvement that you're willing to pursue because you will not go to bed earlier. Or there is some assessment or test or cost or something where it's like a do not pass go. I will not pursue this past this point for you in your mind. And so I think, and I want to call that out because as we start to talk about some of the solutions, it's so common for people to go, well, that's not the cause of my fatigue. I don't want a sleep study. When like a sleep study is how we figure out if you have sleep apnea. There's no other way to figure out if you have sleep apnea. And so you can't just decide that you don't have sleep apnea without going for a sleep study. And so I want you to listen for that in yourself as I'm talking about this, because if you're like, yes, I'm going to take radical responsibility for my fatigue. And then as I talk about things like boredom or distraction
or going to bed or getting assessment or lab work done or maybe seeing a psychologist, if as you're listening, you're like, oh no, that's not the reason I have fatigue, like that really begs the question whether you are taking responsibility for your fatigue, because it will require you to do something that you have not done before if you want to fix it. It will require you to test something you've never tested before if you want to fix it. It will require you of looking at your habits and your life differently than you ever have before if you want to fix it. So, I think we pass around all of these ideas like we don't want to wear fatigue as a badge of honor, and we'd like women to rise above their causes of fatigue so that they can rule the world. That is totally great, and I'm totally behind it. You totally have to do something differently than you have done up until this point for that to happen. And so don't carry around the goal of fixing your fatigue if you're not willing to do the things it takes to make it better. Okay? It's a tough love moment. So where do we start? So it's very common when I worked with patients that people would sit down and they would have fatigue as a symptom. And so as we start to explore this and as we start to come up with, a bit of a framework for thinking about your fatigue and where it's maybe coming from, we have to be a bit methodical about thinking about whether it is from, we'll say like a biological cause, or whether it's from a more psychological cause, which still has biological underpinnings, but just hang with me for a sec, or whether it's related to like environment, circumstance, etc. So let's break it down. There are some biological things that may be going on in your body that have yet to be explored that cause fatigue. So straight up medical diagnoses will cause fatigue. So if there are other things happening in your body, like a widespread joint pain, or if we're suspicious that you have a thyroid disorder, or if you have cancer, or if you are recovering from a chronic medical condition, fatigue is often a side effect of the treatment, or it is a consequence of the condition. And we don't totally understand every biological mechanism that causes fatigue. We know that chronic inflammation seems to lead to fatigue. There are lots of biological routes to cause fatigue in your brain, but having an underlying medical condition that has yet to be addressed or is maybe not being addressed perfectly, or say a component of your condition is not well managed. We see this often with something like thyroid, where your numbers look fine, but you still don't feel that well. There are sometimes these leftover parts of your medical condition that even if your medication or what have you is dealing with the primary symptoms, there may be secondary symptoms or a percentage of symptoms that are not resolved yet. So that is possible. So your fatigue is maybe not independent from your diabetes or from your insulin resistance or from any of the other chronic medical conditions that you have. They're probably connected, okay? So you maybe don't need to search for like a weird and wonderful cause of your fatigue if you have a chronic medical condition. There are other biological systems that are connected to fatigue that should be assessed in order to help us understand if there is this, we'll call it a low-hanging fruit deficiency in, say, nutrients, vitamins, minerals, things like iron. That really should be looked at like very early on in your assessment for fatigue and should be treated, at the very beginning of your whole process in working with your fatigue. Okay? Because, and this is the thing, it's like if we leave anemia, which we'll talk about in a sec, if we leave anemia unaddressed and untreated and pursue some other weird and wonderful cause of fatigue, we're really missing the point, right? Like the likelihood that is a cause is very high. And so if your ferritin is below 50, we'll say, as a great cutoff, although there's some arguments emerging, especially in the world of athletics, where we probably want a higher number than that. But if you're from Ontario, where I am, we literally just raised the bar from 30 to 50, and so we are celebrating that in a big way. There was a time where the ferritin reference range cutoff was like 12 when I started practicing. So the fact that we're slowly pulling all women out of the absolute basement of iron stores makes me very happy. But the reason I'm sharing that is because sometimes we have an idea in our head about whether or not we have iron deficiency. This is similar to that sleep apnea example. You can't just decide that iron is not part of the problem and that you'd like to pursue some other unique, weird, and wonderful cause of your fatigue, like mold in your basement or something. I'm not saying that's not possible. I'm just saying the number one nutritional deficiency globally is anemia. So maybe start there. It's like gambling, right? Like we probably should bet on the ferritin before we bet on the mold. So iron deficiency and having your iron stores repleted and brought up to a more acceptable level. Now, there may be, your next door neighbor may have a ferritin of 29 and they're totally fine, and you have a ferritin of 31 and you don't feel that much better. That you should still be treated. So don't compare your iron levels against your non-tired friend. So everyone's set point for fatigue is going to be a little bit different when it comes to iron. And I think this is where we've probably led all of us astray, is that we have some non-tired people walking around with lower iron stores. And so, if we use them as the reference point, then we don't treat anybody. Don't look at their labs. That's not important. Your labs are important. We should be shooting for more than 50. Other nutrients that are commonly low and can contribute to fatigue would be things like B12 and vitamin D. So both of those, again, very common, low-hanging fruit, easy to test, probably not covered by your publicly funded health insurance plan, but nevertheless, a very important thing to pursue. If you were considering buying an energy supplement for $30, please just spend that on lab work instead if you haven't had those numbers assessed. And the other thing I'll say is if you've had those numbers assessed like more than a year ago, I would repeat it. So a lot can change in a year. You may have adopted some different dietary patterns in the last year. And we do see some periodic times in life where nutrients become more needed, meaning that whether it's seasonal, whether it's situational, and so you are not the same person you were a year ago in so many ways. Let's not assume that you have the same nutrient status that you did 1 year ago. The other assessment that should be done is looking at your thyroid. It's a less likely cause if we just look population-wise. But if you have a family history of low thyroid or any thyroid disorder, if you have a personal history of thyroid disorder, say in pregnancy, but it resolved itself, or if you have other medical conditions that have a higher likelihood of low thyroid. So an example would be any autoimmune condition. As I'm saying this, I'm like, oh shit, Jordan, you were diagnosed with celiac in the summer and you never went and got anything else tested. I should probably have my thyroid tested. Not that I have fatigue, but it would maybe just be good practice. So any autoimmune condition will increase your risk of a low thyroid or Hashimoto's thyroid. And then if you have polycystic ovarian syndrome, there's a really high overlap between that and low thyroid. So other medical conditions might make you a candidate for us to test your thyroid, but at the very basic, your TSH should be done as part of a workup for fatigue.
Do you know what I was dying for when I was a practicing clinician? I wanted someone to summarize the latest research, tie it up with a nice little bow, and deliver it to my inbox every single month. I'm Dr. Jordan Robertson. I'm the host of the Real Integrative Medicine podcast, and this episode is brought to you by my free integrative medicine magazine called The Stacks. We're all dying for unbiased, unindustry-funded information to help us be the best in practice. The Stacks delivers you quality articles every single month on the latest research on things you care about in practice, as well as opinion articles and business advice for integrative practitioners and naturopathic doctors. You can subscribe to the Stacks with the link in the show notes today and get access immediately to all of our back issues that show you exactly how to be an evidence-based practitioner I hope you sign up and you'll enjoy it.
Now, beyond those, like those are general screening. So if you are tired and you're otherwise well, those things really should be done as a starting point. Again, do not look for mold in your basement. Go get those labs done. Where other labs come in is when you have a coexisting medical condition that, again, like I said, is maybe not that well managed or is partially managed, or we're suspicious of an underlying cardiometabolic process that's happening in you, but you haven't been diagnosed yet. So if you are in your 40s or you are in your 50s and you are walking the path of insulin resistance, elevated cholesterol, elevated waist circumference, right? It's, creeping up blood pressure. You may have fatigue as a consequence of that journey that you are on at this moment towards diabetes, towards cardiovascular disease. So again, like I said, we don't totally understand the process there. We think there is a component that's related to inflammation. I did a great deep dive at one time about looking at does insulin resistance itself cause fatigue? Like, does insulin cause fatigue? And we don't think it does. Like, as a molecule, it's not floating up into your brain and flicking a light switch that makes you tired. But there is a sort of metabolic component to being insulin resistant that does seem to increase fatigue. We also know that a lot of the health habits and behaviors that are part of that insulin resistant patient's life also increase fatigue. So very hard for us to separate. Is it the lack of movement? Is it the hyperpalatable and processed food? Or is it something about being insulin resistant itself that causes fatigue? It's yet to be seen. But if you have this, we'll say whispers of metabolic change, or you're looking at your family members in front of you that are older than you and they've sort of started to walk this path towards diabetes and you have yet to be assessed, that may be something that we want to look into more deeply so that we can understand, are you on that journey as well? So biologically, those pieces are related. Pain is an interesting one because we can't really test for pain. Even imaging is not helpful in lots of cases for pain. It doesn't correlate very well, but pain will cause fatigue. So it is a biological component. When I think about this framework, is it like biology or psychology? There is a biological connection between chronic pain and fatigue. It does affect your central nervous system to always be in pain. And that will dampen your brain's zest for life, we'll call it. But that's not something we can test, right? So it's kind of falls in that, do you have a medical condition that is untreated or only partially treated, and what is left over for you is contributing to your fatigue? Okay. But those are the things that need to be looked at from a lab test perspective. Now, kind of hovering in the middle is the discussion on sleep. You have to have a sleep study if you have this sort of relentless daytime fatigue. You just have to. And this is where I'm going to ask you to take radical responsibility. I don't care if you're a woman. I don't care if you're small, meaning that you don't meet the, sort of stereotypical classic overweight patient with apnea. I don't care if you don't snore. Right? I think it's really important that you go for a sleep study to be assessed. And if you get that piece of paper back and it says, nope, no sleep apnea here, fine, right? That's great. That's great. We'll put it to rest. The challenge is we cannot guess. We cannot guess if you have sleep apnea or another sleep disorder. So sometimes with the sleep study piece, we kind of forget that there are other sleep disorders. And I think if we open this up to say, you maybe have restless leg, you maybe have another periodic limb movement disorder, you may have some other issue, then maybe women get more excited about going for a sleep study because they're there's wonder and possibility and maybe we're going to find something. I think we have this negative connotation with sleep apnea that we are so unwilling to consider the fact that we might have it that we'd rather not go. right? And I think if we framed it in a different way, or if we said there's a life-saving test that we'd really like you to have, like, are you okay with that? Please go for a sleep study. Because diagnosing and assessing your sleep is challenging. There's, even when we look at like self-reported ratings on sleep, it doesn't always correlate with how many hours people have got. Of course, we want you to think your sleep is great and for your sleep to be great, but sometimes we have a difficult time doing that objective assessment on our own sleep. And maybe you've noticed that if you have a partner and they're like, I had a terrible sleep, and you're like, every time I looked over at you, you were like literally dead to the world. It's hard to make that correlation. And so it's important that we assess your sleep in a more objective way, which is why I would like you to have a sleep study. But sleep apnea is one of the most common causes of excessive daytime fatigue. And so it's so important that you get it assessed. If you're going to go get your iron tested and you are like in your 50s, please go for a sleep study, because like I said, you would be ignoring an entire component of your life and sleep and whatnot if you don't do it. So I'm really recommending that you get that sleep study done. Okay, so moving over to talking about those psychological causes. And if you're a practitioner that's listening, you know that I've probably left out some potential sort of biological or medical causes of fatigue. When I think about clinical decision making, I'm very much able to hold, space for likelihood and priorities and low-hanging fruit and what do we do first, right? I think it's a different conversation about someone's fatigue if you have done all of those assessments, right? It's a different conversation if you have had your iron tested and it's perfect. Your B12, your D tested, perfect. Thyroid tested, perfect. Sleep study, no apnea. You have no chronic medical conditions. You don't have insulin resistance, or you're not on that cardiometabolic train, right? You don't have chronic pain. If all of those boxes are checked, then sure. Like, there are some weird and wonderful causes of fatigue that maybe we start to like throw a kitchen sink requisition at you. We start to do some imaging that's like unguided, right? Maybe, I'm just saying that's maybe a possibility that we take that approach. The likelihood of someone making it through all of those checkpoints is quite low. And we often, especially in integrative medicine, jump to the weird and wonderful cause of something before we have checked all those boxes. And every single one of those boxes has to be checked first before you look for mold in your basement. Like, it does. They just do. If we're going to go statistically, don't bet on the horse that's never won, right? We bet on the one that wins all the time. And you have to look at every single one of those pieces. If you've done all of those things and it's all in the last 3 months and it's incredibly up to date, move on and look for the weird and wonderful causes of fatigue. But if you have not checked every single one of those boxes, you owe it to your patient, and as patients listening, you owe it to yourself to pursue the unchecked box like relentlessly until you have it fixed. So you can't say, oh, maybe kind of sorta my iron is connected, or maybe kind of sorta my sleep is connected. You have to pursue checking that box like with vigor. Okay? Let's talk about the psychological causes of fatigue. And I'm not going to pretend to be an expert at this, actually. Like, there are, and sometimes when I get lost in the reading on neuroscience and psychology and like all the things, I am so pleasantly surprised and overwhelmed at how much literature there is trying to help understand the way that our brains work. I just find it so fascinating. So the easiest thing for me when I'm trying to translate some of those pieces is to create sort of this story or metaphor, or give you an example of what might be happening in your life in terms of what we need to pursue. But first off, we'll say that almost every single mental health diagnosis also has the comorbid symptom of fatigue, whether you have OCD or bipolar or depression or ADHD, or you have PMS, whatever it is, there is a side effect of fatigue, or fatigue is one of those symptoms. So much like I said for the physical causes of fatigue, is you can't just decide that you don't have one of those things. You need to be assessed for one of those things. You can't say, oh, no, I'm not a depressed person. You need to actually consider it from a sort of more methodical framework versus just deciding that that's not a thing you have. Okay. And I think that's important because especially with mental health diagnoses, we have ideas and thoughts and feelings about each of those words, right? Like as I was saying all of those things, what happened in your brain, right? If I say, when I start to list mental health conditions, do you go, no, not me, nope, definitely not, no, never? Or do you go, okay, wow, yeah, that's a lot of things to consider. I think the way you even listen to that list probably shows you where maybe some of your personal blocks have been as far as assessing your fatigue. If you have just downright decided it has nothing to do with your mental health, that's a really good reminder that you have a big blind spot to look at because your mental health is deeply connected to your fatigue. And if that has been left unexplored, unaddressed, it's only partially addressed. Like I used to be way more depressed and now I'm less depressed. And so that's not causing my fatigue. That is not a math equation. That does not make sense. If you still have residual symptoms of your mental health condition, or even if you're like 95% better, it still may be showing up for you as fatigue. So important to call out. But as you were listening, if you were like, oh, no, this must be biological for me because my brain is not having any difficulty whatsoever, I beg you to reevaluate and just consider, okay? Consider it. And beyond the actual mental health diagnoses, so like I said, that needs to be looked at like with a framework, okay? All of those conditions have diagnostic criteria, right? We don't accidentally flag people with PMS. We don't accidentally flag people with OCD or with burnout or with ADHD if we actually assess them properly, right? You will not accidentally get flagged with one of those conditions if your doctor follows the diagnostic criteria. We have built that criteria so that we don't catch people that we shouldn't. Where people get misdiagnosed is when it's being done haphazardly, or it's not being done with a framework in mind, or it's being done on TikTok. That's how we end up with problems in terms of diagnosis, is when we aren't methodical about it. And when I teach diagnostics at the Confident Clinician, we want a framework for how clinicians move through decision making, right? We don't give them a list over here for ADHD and a list over here for depression. We dialogue about the difference between them and how to know if they're both happening in your patient, how to know if it's one or the other or neither that's happening in your patient. And that's what our clinicians get access to. It's not like checklists, it's actual dialogue and decision-making framework. And so if you have not had that done, or if you have not considered any of your mental health in terms of how your fatigue operates, then that's something I'm going to invite you to do, right? And talk to your practitioner or talk to a practitioner about it. So any mental health condition increases your risk of fatigue, or fatigue is part of the symptom experience of that condition. Now, beyond that, there are some, I'm going to call them like subclinical diagnoses, where they're not formal diagnoses, but they still contribute to fatigue, because fatigue in some ways is a lack of engagement for your brain, a lack of engagement neurologically. And so boredom actually falls, and being understimulated falls in this entire category. And I have met lots of women where we've checked all the biological boxes, they sleep pretty fine, and then we get down to the like, are you bored? And when we think about boredom, and it's funny, I was talking to my husband about boredom, and he's like, because I've been doing a bit of a deep dive on burnout and was reading about boredom and like what we think neurologically is happening when we're bored. And he's like, so like, is boredom good? Are we right? And I think when we talk about boredom and we say to the kids, like, go be bored, go like do a thing and be bored, it's good for you, and we're trying to get them off of their devices, we're using boredom as a term like almost with like affection, right? Like we're remembering the 80s when we went outside and we came home and the streetlights came on, and that was like boredom, except that's not what boredom is. Because what happened when we put you outside, right? What happened if we put you outside? You would find something to do. You'd make a fort, you'd make a friend, you'd play a sport. That's not boredom, okay? Because boredom is an absence of meaning making in what you're doing. Boredom is an absence of meaning making. And if we push our kids outside, although, it takes them like 15 or 20 minutes to whine about how we have pushed them outside, when that is over, what do? Right? They're like smashing ice with sticks, or they've created some kind of game, or they found a frozen basketball and now they're going to create a new sport with it. They do meaning-making activities outside. If we push ourselves outside, eventually we will find a meaning-making activity. Being bored and reading a book is not the same, okay? Being bored is your brain's lack of engagement in anything, which might be due to understimulation, right? When we are understimulated and we can't have meaning making in what we're doing, then our brain can fall into this lack of engagement style of feelings, which is boredom. And we do see it in like repetitive type jobs or tasks where we are detached from meaning making. That sounds a lot like burnout. Burnout is a little different, where we start to where we were at one time, we really loved the job. Whereas if you're just like stamping boxes as they go by on a conveyor belt, I'm not sure when you started that job, you were like, I'm changing the world. Here I am stamping these boxes. You knew what the job entailed when you signed up for it. You knew it was repetitive. You knew it was like borderline boring, and now you're bored. Burnout happens actually after periods of like over engagement in work and being incredibly, almost like we have overhyped what we think the job is going to entail, and overcommitment in work and leaning in way too far. Burnout comes from that. And so the depersonalization and the detachment that comes from burnout is different than boredom. Okay. That's like a consequence of overwork, whereas boredom is like we don't have meaning making, period, because the task is like underwhelming for our brain. So that's that. Boredom can also happen when you are overstimulated with complex information that your brain cannot process. That can also lead to disengagement. And have you ever been in a lecture where, or like I'm thinking of like me in calculus in first year university, and I had done pretty well in high school calculus, and then I just did not have the skill set or the study skills to transition to university math. But I remember being in the class and being like, I have no idea what they're saying. And that actually can create fatigue and disengagement. And that creates a lack of meaning making because you can't even tie it together what's happening or being said. And I think that is actually possible because, and this has not been studied, this is my own hypothesis about what's going to come out, is that when we're being overwhelmed by information online, I think there is a high likelihood that there's going to be a sort of boredom fallout that's coming from that and contributing to your fatigue. So boredom is this like detachment from meaning making. When you're scrolling, you're doing two things. You're doing a repetitive and not meaningful activity, and you're being overwhelmed by an incredible amount of information. It leads to your brain being detached in general and finding it hard to have motivation because of the lack of meaning making of the activity. And so, which is so fascinating, right? Because we imagine that we like scroll because we're bored. I actually think the scrolling is probably causing boredom and fatigue, but again, remains to be seen. But I think that's important. But I'm calling it out because fatigue can come from a lack of purpose. And so, yes, check all the boxes. Don't walk around with low iron. But fatigue does come from having a lack of purpose. So if you are hearing yourself in this conversation around boredom, it's important for you to consider whether or not you have enough meaning making or meaningful activities in your life to keep your brain interested and engaged? Or have you created a self-fulfilling prophecy where you're sitting on the couch and now you're scrolling and now your brain's bored and now you're tired, so now you can't garden, so now you're going to scroll, right? Versus if you read a book in that same half fetal position, you are doing a meaningful activity, and that will create meaning making in your brain and will decrease your fatigue. Okay, so calling that out I think is really important. And then when we take it into the workplace and looking at the rest of your life and the rest of your day, I mean, of course, we need to consider the potential for burnout and overwhelm in the workplace. And so it's common, and I would say that I don't know if things have got better since COVID. I don't think so. That many people are doing the roles of multiple people in their workplaces. Workplaces are making big technology overhaul changes, all the things that are happening from a systems level that are probably impacting you and your work. Those can create feelings of fatigue because we're starting to walk down that sort of burnout line. And burnout's really fascinating because it is a continuum. It is a process, and people don't often realize they're in that continuum until I'm going to use the words too late. Not that you can't recover from it, but we're not that good at foreseeing the challenge coming down the line. I looked at this job really euphorically, and turns out it's not exactly what I thought. Even that thought alone is part of the burnout continuum, because when we're overinvested, when we've really hyped position in our brain, we have more disconnect when reality starts to set in. They've done some really neat research around what if we pre-prepare people for their jobs by showing them some of the negatives of their jobs before they even apply, and say yeah, we've got all these great things, but here's the downfall of working here, essentially. And those people are less likely to fall into that burnout path because they've gone into the position with eyes wide open, versus when we pursue a new project, we pursue a new position, we go in being this is the love of my life, this relationship's the best thing that's ever happened to me. We have this huge honeymoon period where people overachieve, they take on too much, they don't ask for help because they're trying to look great. And then the consequence of that is that they've started down this path of setting themselves up for a neurological disconnect that is burnout. So your workplace, and thinking about that and the contribution that your work-life balance is having on your fatigue, I think is really important. And there are really well-established strategies for helping improve burnout. A vacation doesn't work. There's actually literature on vacations not working. But what does work is helping with gratitude, helping with journaling to create more resiliency and self-compassion. We don't have time to talk about that in today's episode. But what I'm calling out is that if you want to take radical responsibility for your fatigue, part of that includes taking radical responsibility for yourself at work. The burnout conversation can't help but talk about systems, and not all of your workplace burnout is your fault. There's a huge percentage of it that is not your fault, but your responsibility is yourself. And so knowing that if you do a gratitude journal actually helps you stay in your position longer, helps you feel more connected to your workplace. Doing letter writing, as if you were a friend and you're going to write yourself a letter to give you some advice around how to navigate your stresses at work. There are some really well-researched ways to help create some cognitive resiliency in you in the workplace. And so I'm calling out the burnout piece because we can't help but. It's a major cause of fatigue that is more psychological than it is biological, even though biology changes in your body and brain when you are burned out. So from a psychological side, right, I've said if you have a mental health diagnosis, or you should have one, you should be assessed, that's what I mean, then that's going to cause fatigue, okay? If you are bored, that's going to cause fatigue. If you are engaging in activities that don't create meaning, that's going to cause fatigue. If you are burned out at work and meet the actual diagnostic criteria for burnout, then you are going to have fatigue. There are many processes that happen psychologically that cause fatigue. The one that's kind of hanging in the middle is the discussion on sleep. And we talked about sleep apnea. I've said you have to go for a sleep study, but it's remarkable to me how few people get the recommended number of hours of sleep, and that do, we'll say self-sabotaging behaviors that get in the way of that resource. So just as like you need to go to work in order to make money, you need to go to bed to make energy. And we rarely think about it in those terms. We rarely think about the sleep today prepares me for tomorrow. I would often work with people who were like, the sleep tonight is recovering me from today. And that is a very, very different way of thinking about things. And when you were like in your 20s or younger, you could recover from things, right? It's like you used your sleep and your nutrition to recover from the previous day's assaults on your body, whether that was staying up too late or whatever. Now, we need to use our sleep to prepare for tomorrow. That is what your sleep is for. It is to prepare for tomorrow. And so if tomorrow is important, why aren't you going to bed? If tomorrow is important, why are you watching a show? If tomorrow is important, why are you folding laundry? Right? Like, ask yourself that question. And I bet if those activities, the show, the laundry, whatever, are super important for you, you can find time to do them before 10 p.m. You can. If tomorrow is important, you have to go to bed. And so if you're getting less than 7 hours of sleep because of a habit, of a behavior, of a substance, alcohol that you're drinking that's impairing your sleep, that has to go. If fatigue is your primary symptom and the most important thing that you get rid of, you have to go to bed. And that is taking radical responsibility, because it's saying you're worth it. It's saying this laundry isn't worth it. It's saying a lot of things about what your priorities are if you're willing to go to bed on time and hold yourself accountable to that promise. I want my fatigue to get better. Therefore, I go to bed because I'm preparing for tomorrow. It's easy for me to say, and you probably would say it to a friend. You need to say it to yourself. So to summarize, we talked a long time today. To summarize, if you want to take radical responsibility for your fatigue, you have two things to do. One is to be thoroughly assessed. Blood work, have someone assess your mental health, hard look at your work-life balance, hard look at your boredom, right? You need to check every single one of the boxes I said today in order for you to be off the hook in terms of looking for a cause for your fatigue. You do. The other piece is you have to take a really hard look at some of the habits that might be getting in the way of you achieving a better sleep or better connection in your day, right? How do you create meaningful activities? And part of that is getting rid of the non-meaningful activities that are going on in your day. And so that radical responsibility comes from taking that bird's eye view or inviting somebody else into your world to let them take a hard look at what's going on. And I mean a practitioner, so that they can help you get thoroughly assessed. But that framework of thinking about your fatigue will go a very long way. We talked about the things that, and I'm not going to put a statistic to it because it'll be wrong, but we've talked about the majority of the causes of fatigue in people. And so checking all of those boxes will help you deeply understand what's going on inside your body and brain to help you overcome fatigue. I hope you had a great week, and I will see you next week.
That's it for today's episode of the Real Integrative Medicine podcast. I hope you're feeling inspired, informed, and ready to make changes that truly support your health. If you found value in today's discussion, don't forget to hit subscribe, share this episode with someone who needs it, and leave a review. It helps us reach even more listeners just like you. Your health journey is personal and it's powerful. Let's keep building on the knowledge to give you the confidence you need to thrive. It's important to remember that the Real Integrative Medicine podcast is for educational purposes only. Be sure to talk to your doctor before making any personal health changes. This podcast isn't intended to diagnose you, and no doctor-patient relationship was formed by listening. We'll see you next week.